We understand that it really takes some courage for people to reach out to healthcare providers, and particularly people that they don't know, after having been sexually assaulted or been in a life-threatening situation. We always appreciate it when people do reach out to us because we are here to have conversations with people and offer whatever kind of care it is that they might like to have.
My name's Natalie. I'm a forensic nurse here at SAFE. My main role here is to make sure that you're healthy and you're safe. Everything else that we do here is completely optional. I'll go over all of your options with you, but you get to pick and choose what you do and don't want to do as part of this exam.
Okay. When people choose an evidence collection exam, that process can take about 4 hours. Most of it's talking, and it includes things like your medical history. What are you allergic to? What kind of medications are you taking? Those kinds of questions. It also includes a history of what it is that happened. We'll ask for that information and then write it down verbatim, and that helps us understand what we need to do with the rest of our encounter. It helps us decide what we need to look for and where, and things that we might be able to skip, and things that we need to focus on.
What if I don't know some of this stuff?
If you don't know, that's totally okay.
Okay.
That's a completely fine answer to just say I don't know.
Okay, because there's a big portion of the night that I don't remember.
And I encourage you not to try and fill in the blanks and just tell me what you remember, and that's okay.
Okay.
The process also includes a head-to-toe exam. We're going to look for injuries. We're going to look for any place that there might have been touch contact or that we know there was touch contact, because we will stop and swab for DNA. That's a pretty simple process that involves Q-tips that have sterile water on the ends. We just rub those against people's skin and then package those up and send them along as well. The head-to-toe exam, checking for injury, can include diagramming, measuring, and photographing injuries if people are okay with us doing that. The last part of that exam is usually taking a look at anogenital area, and it's for the same reasons. We're checking for injury, we're swabbing for DNA, we're also looking for anything that might not belong to that person. That part of the whole encounter takes about 5 minutes, unless there's something that's out of the ordinary that needs to be dealt with.
I know you said you're not sure if there's any contact to that part of you, but sometimes DNA can end up in that area just because all the ridges that are there.
For people who would like to have an evidence collection exam without talking to the police first, there are a couple things that are different. We are not going to collect blood or urine for toxicology, so if somebody thinks that they might have been dosed with something, that might lean them towards considering reporting to law enforcement, because that's the only way that those things are going to get collected and then potentially tested. The non-report option is designed to give people some time to think about what they might like to do and whether or not they want to involve the police after a sexual assault.
A survivor can have a complete evidentiary exam without reporting to law enforcement within 120 hours, that's 5 days, of when the assault happened. They can have what we call a non-report exam to go ahead and gather and preserve that evidence so that it's not lost. And then they have 5 years to decide if they want to report to law enforcement or not. Meanwhile, that evidence is preserved.
So if I did this without talking to the cops, does that mean my evidence gets tested?
So if you don't report to the police, the evidence would just go to storage. So there would be no testing of any of the swabs or anything unless you decided to report to the police.
Okay, because I don't know if I want to call the cops or not at this point.
At any point during that 5 years, they can decide to convert that kit that was collected to a report, and then that evidence will be submitted for testing.
If someone comes in less than 120 hours, we are able to provide a medical forensic exam. That includes evidence collection, a pregnancy test, medication that can prevent pregnancy, medication that can prevent sexually transmitted infections, testing for infections as well. If someone comes in after 120 hours and they have, which we consider that a non-acute examination, we are able to still provide the medical forensic exam. With that, we won't collect any evidence, but they are able to receive medications if needed to prevent infections, or we can offer them testing to prevent infections.
In the state of Texas, victims have the legal right to have an advocate who is specially trained in the room with them during their evidentiary exam or their sexual assault medical forensic exam.
I'm Christina. I'm going to be your advocate today. I'm going to be with you here during the exam if that's something that you would like. It's your right. I'm here to support you, provide you emotional support. We can do some safety planning to make sure that when you leave here, you feel good about where you're going.
Advocates also play a crucial role in providing crisis stabilization, talking to survivors about the effects of trauma and maybe what to anticipate in the coming days. Another legal option that advocates will discuss with survivors is their legal right to use a pseudonym or not.
And what that is a name that they choose that's not their own to protect their identity. And that can be used in the police report, in court documents, and it gives them some anonymity as they move through the criminal justice system.
Pseudonyms are a part of safety planning because some survivors, that might be a deterrent to reporting to law enforcement, and then when they understand that right to use a pseudonym, that makes all the difference in them feeling comfortable going ahead and making a report.
It's important for people to understand that it's not your fault if you've been sexually assaulted. And we take care of folks in a way that is very centered on them and very trauma informed. And we provide options, and we don't have an agenda really outside of healthcare and well-being and safety. So those are the things that we like to emphasize when people come in and have questions.
The first step would be to call our 24/7 confidential safe line. You can call, chat, or text.
We are available 24/7 for the medical forensic exams, and you can call our nurse line 512-738-8817. We are able to do all of those things for free.